Iodine 131 is the highly radioactive, unstable form of the element iodine. It has 4 extra neutrons in its nucleus and has a half-life of 8 days. This radioisotope produces both gamma and beta radiation. Beta radiation is made up of beta particles. Beta particles are fast-moving, negatively charged electrons. They can penetrate human skin and cause damage to living tissue. Beta particles pass through a piece of paper, but are stopped by a thin piece of metal, like aluminium foil. Gamma radiation travels in the form of electromagnetic waves. Gamma waves move at the speed of light and have a lot of energy. If they penetrate human skin, they can cause permanent damage to living tissue as well as DNA cells. Gamma waves are stopped by thick pieces of lead or concrete. Iodine 131 is used in the treatment of thyroid cancer and other thyroid-related diseases. In the treatment of thyroid cancer, Iodine 131 is consumed either in a liquid or capsule form. It is then absorbed by your blood and taken up by the thyroid gland. The thyroid cells are the only cells in your body that absorb iodine, so no other living tissue is affected. As the cancerous cells take up the Iodine 131, they are killed. While this procedure does not take long, it is done in the hospital where your radiation levels are monitored. 1 week after you have finished treatment, you will be allowed to go home as your radiation levels are safe. After a few months, you will have to go in for a follow-up radioactive scan to ensure that no more cancerous cells have been left behind. Many advantages to the use of Iodine 131 as a treatment, and some of them are: it is a less invasive option in comparison to other treatments. The radioisotope is ingested and the cancerous cells are killed internally, which completely removes the need for surgery. It is also a less painful treatment. If you were to have surgery on your thyroid, you would have to go under a local anesthetic and have constant pain medication afterwards. The Iodine 131 treatment does not require any painkillers. And finally, it completely destroys the cancerous cells. With surgery, there is a chance that small cancer cells will be left behind and will result in secondary cancer. As all the cancerous cells absorb the iodine, they will all be killed, thus reducing the risk of secondary cancer. However, there are some disadvantages with the use of Iodine 131, and they are the fact that the radioisotope Iodine 131 produces a much higher amount of radiation than medical imaging equipment. So, if this treatment is not administered properly, it can lead to thyroid cancer. The amount of Iodine 131 given in thyroid cancer treatment is not an exact amount. So, if you are given too much of the radioisotope, it may completely destroy your thyroid. If this does happen, you will need to be on thyroid medication for the rest of your life. And finally, you will need to be isolated for a week after your treatment because your radiation levels will be high. This can pose a health risk to others around you, especially pregnant women and babies. Iodine 131 should be used in society as the benefits far outweigh the risks. It is a cheaper, less painful, and less invasive thyroid cancer treatment option. It has saved thousands of lives and has successfully been used in medicine for years. Therefore, the use of Iodine 131 in medicine should continue.